Good morning. Everybody can hear me okay? Thank you for joining us. I'd like to introduce you to Hidalgo County Judge Richard Cortez.
Thank you, Carlos, and good morning. You know, last week I urged caution, saying that the number of people being hospitalized with COVID-19 were once again going up, and that the residents of Hidalgo County needed to be careful when they're out there in the public. This week I received word from Hidalgo County Health Authority, Dr. Ivan Melendez, who's sitting to the left of me, that the numbers are not improving. And any notion that we have reached herd immunity is just completely false. In fact, Dr. Melendez said that in the past week, Hidalgo County has seen approximately a 100% increase in COVID-19 hospitalizations. An amazing statistic is that 90% of this being hospitalized with this virus have not been vaccinated. What does this show? That this is strong evidence that vaccines do work. Just as alarming, our health director, Olivarez, tells me that the number of those getting this life-saving vaccines is declining. People are not seeking the vaccines. This is a dangerous combination for our community that is coming at a very critical time. Our children are getting ready to go back to in-person schooling. We learned yesterday that state funding from the Texas Educational Agency will not be available for distance learning the way it was in the past. That means that our schools will be required to provide in-class instructions, and they want to receive money from the state at the time our COVID numbers are rising and new variants of this virus, including the very dangerous Delta variant, which we know now is in Hidalgo County. I cannot emphasize enough how important it is for all of us to get vaccinated and to follow the safety protocols that we know work. I cannot emphasize enough how important it is for our children and their schools that all of us get vaccinated. You know, weather experts tell us that a dangerous storm is coming. Most of us will make preparations for the storm. Unfortunately, there will always be some that don't feel the need to prepare. I'm telling you today that a dangerous storm is coming. And if we do not prepare, it may be our children who now have become the most vulnerable to this virus who will suffer. A year ago, I had important tools at hand that allowed me, as the county's emergency management director, to try to slow the spread of COVID. This included mask mandates, capacity limits, and even curfews. And if you don't believe masks work, consider this. COVID-19 is a droplet-borne virus. Other droplet-borne viruses, such as the flu, have now seen a 400% decline in infections compared to last year in Hidalgo County. So the respiratory infections have declined 400%. This year, Governor Abbott has decided that counties may not use these tools that we had in the past. I would encourage our residents to petition the governor, asking him to allow us to use these tools that we know work. Thankfully, the most significant tool available is the vaccine. And while I cannot mandate that people receive the vaccine, I can strongly urge everyone to do so. The second major tool available is personal responsibility. I know masks are hot and sometimes not comfortable. I know that avoiding crowds is no fun. I know that stepped up hygiene is time consuming. but I urge everyone to consider our community instead of our own inconvenience. If you're not willing to do so for yourself, then do so for our children, especially our younger children who cannot get vaccinated. Wear a facial covering, practice social distancing, employ good hygiene. This pandemic is not over. Now I would like to introduce the head of our health department, Mr. Eddie Olivarez, who has more information for you. Mr. Olivarez?
Thank you, Judge. Good morning, everyone. My name is Eddie Olivarez. I'm the Chief Administrative Officer for Hidalgo County Health and Human Services. Today is an important day because we have an opportunity to take advantage of our vaccine programs, of our preventative efforts to help get this illness under control and avoid major outbreaks. Today, as of 7 o'clock this morning, we have 128 in the hospital. 128 people in the hospital, 41 in ICU as of 7 this morning. If you think about that, that is, if I look at the week of July 11th through July 18th, since then, we've had an 88% increase in hospitalization and a 95% increase in our ICU admissions. We're having more people go to the hospital. We're at 12.19% of all our hospital beds in Hidalgo County. The staffed hospital beds in Hidalgo County, 12.19% of those have COVID patients in them. Remember, at one time, the governor stated that anything above 15% would be a mandatory requirement for a lot of the different stages that he put several months ago. Today, we're at 12.1%. Important point to look at. The other thing is, we have not reached herd immunity. There's a lot of media that's very positive and very nice and makes you feel good that, oh, South Texas is one of the highest areas of vaccination. But we're not at the point of herd immunity when you consider the fact that those numbers do not include people that are less than 16 years of age, because that's the way the statisticians have figured it out at the state. So we got to consider that. And Dr. Melendez will actually talk about that in a little bit more. The point I want to really emphasize is that these help keep our community healthy. Judge just announced a 400% reduction in respiratory infections in Hidalgo County. 400%. The social distancing, the mask wearing, the hygiene, all help. Very important that we look at that. If we sit down and think about where we were last year on this date, we had 965 people in the hospital, 235 in ICU. The 128 doesn't sound that bad. But if your family member is one of those 128 in the hospital, or if your family member is one of the ones that passed away yesterday, it's bad. And there's no reason we should be at this point when there is a vaccine to stop this illness, to help prevent and lessen the impact of being hospitalized. We have 4 variants in Hidalgo County that have been confirmed. We have the British variant, the Brazilian variant, and 1 Delta variant. Those are the ones that we know of. We also have the California variant. It's a lesser variant, but the 3 main ones are Brazilian, Delta, and British. We need more testing in those areas. Judge has asked the Commissioner of Health in the state of Texas to make testing more available to our hospitals to test for the variants so we can get a better feel for the actual variant numbers. That's been a request, and we continue to ask for that support. We got some slides I wanted to show Mr. Sanchez real quick.
Just for your information, media, we will be providing slides to you so you can take advantage of it, but they're up on the screen.
This one is the COVID slides that have the cases, hospitalization, and ICU curve. It melds all 3. If you could see, on February 2nd, there's the second spike that you see there. That's when we really started looking at large-scale, massive vaccination changes in our county. By then, we already had enough vaccine introduced into the community that it allowed to have protection. You see that drop? That drop is because of vaccines. Vaccines lessen the impact of hospitalization. It does not take the disease away, it just lessens the incidence of you going to the hospital. The next one. As you can see, the impact of percentage of hospitalized, make sure I got the right one, has increased over the last week, 10 days. The number of cases are going up in the hospital. Very important that we realize and see that as what it's worth. We're looking at percentage of change of ICU cases since July 11th through yesterday, the increase in cases that are taking place in ICU. Very important. Next one. Make sure I get the right one here on my sheet. Sorry. The percentage of weekly hospitalization count. As you see, our hospital count has increased significantly compared to 2020. The blue line was the rate of increase in 2020. The red line is the increase in 2021. We actually have a greater increase in hospitalization at this point right now than we did last year at the same time. Now, of course, the numbers are different, but the rate of increase is higher, the rate. So from that perspective, we need to take into account all the impact that this has in our community. And the reality is vaccines lessen the COVID impact on each person that decreases significantly the chance of you going to the hospital and needing help in the ICU and other areas. It's very important. I will pass this next to Dr. Melendez for his update.
Thank you, Judge. Thank you, Mr. Olivarez. I hope you all can see me above the podium. I'm the most vertically challenged of the three. Primero, muchísimas gracias por ser parte de colaborar con nosotros. Sin ustedes, realmente la información no llegaría a nuestra comunidad. So thank you so much for helping us get the message out, and we're very grateful for that. You know, my comments are pretty much echoing what the two previous people had said. We noticed anecdotally several weeks ago, and then greatly enhanced last week, where as a clinician in the hospitals and in the COVID units and in the general units, I started having physicians come to me, ID doctors, internists, family doctors in the hospital coming to me and saying, hey, Dr. Melendez, what are we going to do? What are we going to do? When are you going to recommend the use of masks? These numbers they're painful. And indeed, we all who are where the rubber hits the road had noticed that. We were admitting more and more people, a different type of person, a younger person, people my age, as opposed to last year when most people were a little bit older, Eddie's age. And so my point being is that there was a call to arms, and there was a call to arms by the clinicians, there was a call to arms by the infectious disease doctors, and there was a call to arms of patients' families. And we looked around us, and we had discussed this many times before, sometimes late into the night, about, you know, what is the reason behind what is going on? What are the national experts, the state experts, our local experts, understanding the reason why this is occurring? There is no question that the numbers and the problem that we have is increasing. If you use any parameter to measure it, as those labs illustrate, anecdotally illustrate, the numbers are going up, and they're going up dramatically. How can you go from 46 on a Friday to 120 7 days later? How can you go days without people dying to 2 to 4 people dying a day? And so I don't think it's worth the time to argue that there's a problem and that the problem is increasing. And then, of course, our job, at least my job, to recommend to these gentlemen here is the why. And I believe that the reason that our numbers are increasing dramatically is the following. Our enemy has gotten more virulent. The enemy that we were combating last year is not the same enemy that we're combating today. The virus that left Wuhan originally is not the same virus we're doing today. We all know that in nature itself, everything that's alive mutates in order to survive better. And so we know that this virus has been very successful in doing so. We know that the influenza virus does it. They're the experts. That's why we get a shot every year, because it changes so much. But we have the documentation from around the world, whether it's the Delta variant, the Delta Plus variant, the Lambda variant, the Alpha B12 variant, the Brazilian variant. I mean, there are immeasurable numbers of variants. There's 15 that are being followed as potentially more virulent, but there's so many different variants. And, you know, some variants do not move toward greater success for the virus, and so they die away. It's just the way human beings, sometimes we're born with congenital problems. We don't survive into older age. But we know that the enemy has gotten significantly stronger and wiser. Well, what else? Why is this still occurring? Well, if you look at the charts that he's shown, if you look at our community, you know that there's a indirect relationship with vaccination and the incidence of the disease. And so we have also gotten stronger. Not only has the enemy gotten stronger, but our troops have gotten stronger too. And we've gotten stronger not because we have better treatment. Unfortunately, we know more about the virus, but we still don't have a cure for it. The treatments that we were using 10 months ago are pretty similar to the ones we're using now. But what we've been able to do, and what we've seen as the only directable, measurable impact, has been the vaccine. We know that the vaccination is still efficient with the variants that we're seeing. And we see directly that, you know, when 70 people were dying a day, when we had 1,200 people in the hospital. Last year at this time, we had almost 1,000 people in the hospital. Last week we were in the 40s. Today we're in the hundreds. So what is the only thing that's changed? It's not that people are being more compliant to behavior. The only thing, it's not that we have better treatment. The only thing that's changed has been the vaccination. Some people in the national dialogue of us public health officials are referring to this as the pandemic of the unvaccinated. If you look at the people that are vaccinated, they're not having a pandemic. The numbers are dramatically low. The numbers that we're seeing are the pandemic of the unvaccinated. And so that's what at least my focus is this morning, is to do two things. One, within the limitations that we have based on the governor's mandate and allowing us the flexibility that we have, then we have only certain things that we can strongly recommend. And we cannot do anything about the behavior of the virus. We cannot do anything on a local level about the research and the protocols for the treatment of the virus. The only thing that we can impact as your representatives in our community is to guide you, because that's our responsibility, your health, to guide you in those activities that we know scientifically, free of politics, are going to lead to better outcomes. And so, as the judge said, if the weather person is telling you, hey, low probability, high tension, winds coming from the southwest, we think the hurricane's coming, we know that some of you all will board up, will evacuate, will do what you think is appropriate, and we know others will have hurricane parties. And so my concern is that I'm seeing a lot of hurricane parties. And I mean, that's our nature, right? We're happy people. But this going unvaccinated only allows this virus to continue to mutate. And I will tell you, there's not a shadow of a doubt that from a mathematical pure perspective, using just basic math, the time will come when we will have a mutation, a variation, that will no longer be amenable to those few tools that we have now. And so every time that you are infected or you pass it to someone else, every time that the virus replicates, which is millions of times a day, every time there's that little change, there's a possibility for something to just not lie up the way it's supposed to in the RNA molecules. And guess what? You have variations. And so we don't want to be the voice, kind of like I am with my kids, always, negative, 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 negative. We don't want for people to hear us and say, all those guys have to say are negative things. But our job is to tell the truth. And this is the truth as we see it, free of politics, with the number one priority is to take care of you all. The same thing that we're recommending is what we're doing with our own families. My children will go back to school, and they'll be wearing masks. My mother got vaccinated. Everyone I know, I try to vaccinate them myself, as a physician, a clinician, an ex-patient, as a health, first in line. And so we want you to hear our message, and that is what we are able to do based on our authority or our recommendations to he who has authority is to impact personal behavior, personal responsibility. And there's really a few things we can do. If you're vaccinated, act like a vaccinated person. If you're at home, if you're at work, if you know your environment, act like a vaccinated person. That's reasonable. If you're unvaccinated, nothing has changed. And in fact, if you're unvaccinated, you're the population that's keeping this alive. It's not that it's your fault, but the truth of the matter is, it's only living in you. We have had 4 people die that have been fully vaccinated, 4 out of 3,000. We have a less than 10% of people that are hospitalized that have been fully vaccinated. We're seeing more and more every day people who are vaccinated and are turning positive. Fortunately, not in the hospital. And that's to be expected. The vaccines are 90, 95, 80%. It's kind of, in one sense, a good thing if we're seeing more people that are vaccinated that are positive, because that means there are more people that are getting vaccinated. And so those of you who are hearing us this morning that have been unvaccinated, look at the numbers. And in my opinion, there has to be some personal commitment to our community. We cannot tell you what to do. Our role is not to force you to do anything. I don't think any of us up here are in the mode to force you or tell you what to do. All we can tell you is, here's the evidence, here's the science, here are the facts. You're an intelligent person in the community. Make the decision. I cannot see anyone that would argue on the other side when you just look at the absolute numbers. And yes, there is danger in vaccination. Yes, there have people that have had tremendous allergic responses for their first vaccine. And of course, we recommend do not get the second vaccine if you've had a tremendous allergic reaction. And yes, we have to be very careful. So I'm not going to lose credibility telling you that there's no danger in the vaccine. But the danger in the vaccine versus the danger of the virus is comparing the danger in swimming in your pool than swimming in the deepest ocean, during a hurricane. It's just the risk factors are just completely not even comparable. And so, yes, there's a danger, but negligible compared to what if you do get the disease or your mom or your kids. Children are not impacted, really. Why does the Academy of Pediatrics recommend strongly mask use when back to school? They put out a statement yesterday. The American Academy of Pediatrics says we strongly recommend the use of masks when going back to school. If children are unaffected, how come we've had 3 people in our own community that have been less than 18 years old that have perished? How come we have in the hospital right now 4 kids whose primary reason for being admitted is COVID? So yes, it's 0.0001 mortality rate versus 1 mortality rate in adults, but they're not immune. They're human beings too. So if you vaccinate 100% of the people in the community that are eligible for the vaccine, you still have 20% that are unvaccinated. And those people, although they may not die, although some might, although they may not die, they're the ones that are keeping it alive. And so is there a future with vaccinations? Absolutely. But for right now, there isn't. And so we urge parents to vaccinate their children, and we urge everyone who's out there still holding out. And let me tell you, last week there was light at the end of the tunnel, Judge. Last week we saw the highest first-time vaccination rates than we've seen in months. More people, hundreds of people were vaccinated last week that had not been vaccinated before. And after it had been stagnant for those first-timers, which means they're seeing the numbers, they're having family members. The community is beginning to understand that this is not going away, not going to go away. And with your assistance, you guys are helping us carry that message. And for that, we're deeply grateful to you. So thank you.
And now to offer the perspective of schools is Dr. Xavier Salinas with the Hidalgo Independent School District.
Good morning. I want to thank the county judge, Eddie, and Dr. Melendez for being here today, spreading the message that masks do work, and masks are so essential to the school systems. I know that recently the governor had set up a no mask mandate, and I'm asking why? Why would he do that? We have county leaders, city leaders, school leaders that are in the trenches every single day. We know what needs to happen in our communities, in our school systems, in our cities to make it a safer environment. All I ask is for all of us, and the reason I call these three individuals, because together we're stronger. We have a stronger voice. And I ask that everyone call their representatives, everyone call the governor's office and bug them to give us the flexibility to make the decision for our schools, our communities, our county, because we know what's best for our schools. Right now, when the pandemic first hit, the vaccinations was targeting the elderly, the most vulnerable population. Now this pandemic is going to target the most vulnerable, our 3-year-olds to 11-year-olds. Those students and those kids will not have the opportunity for a vaccine. So what's best to combat the vaccine, as the county judge, Eddie, and Dr. Melendez says? Masks, hand washing, social distancing. Unfortunately, the Texas Education Agency has said none of those are required in a classroom anymore. When the pandemic first hit, they said you have to be 6 feet apart. Now they're saying you don't need to be 6 feet apart. You can only have so many kids in a bus. Now you can put 77 kids in a bus. So all those requirements that were first brought out no longer exist. So what we're asking is, give us the flexibility. I, as superintendent of schools of Hidalgo ISD, know better than what the governor is doing, because I'm in the trenches every day. I'm around the kids every day. I'm around our teachers every day. They are creating a perfect storm for a huge outbreak of COVID in our hospitals, from 3 to 11-year-olds. Do we have space for them, Dr. Melendez?
Absolutely, we have space for it.
So we will take care of them when they get sick. But imagine, Hidalgo County has 400,000 students in it. Between 3 and 11 years old, that is a lot of kids. Imagine if those kids get sick in schools. So we want to be able to make the flexibility, wear a mask. I plead to our parents. The first day I could get my 12-year-old vaccinated, I did. She was the first one there. She goes, Daddy, just got approved yesterday. I don't care where we're going. I got her vaccinated because I know the vaccine works. The first chance I got it, I got it. I plead to everybody, if you're not vaccinated, go get your vaccine for the benefit of your kids, especially if a 3-year-old to 11-year-old or a newborn. Because with the research that I do, and I do research every day on this, the adults are taking it home to their kiddos. The adults are taking it home to them. We just want flexibility to wear masks. And parents, if we don't get that flexibility the next 3 weeks when school starts, I appease you that have your kids wear a mask to school. Make sure they wear a mask to school to protect themselves and protect others. And I know that this perfect storm is being set up until we can get the vaccine for those kids at school. And I just ask one more time for all of us to call your representatives, your senators, your governor, and say, give the county judge, give the mayors, give the superintendents of schools the flexibility to decide for themselves. Every county is unique. Hidalgo County is unique from a different county up in the north. The numbers are here or higher. We just want flexibility. We want to do the right thing. Because my number one goal as superintendent of schools of Hidalgo, safety of my staff, safety of my kids, safety of my community. Those are my number one goals right there. And with giving us the opportunities to have them wear a mask every single day, I can provide that safety that my kids need. Once again, County Judge, thank you, Eddie Olivarez, Dr. Melendez, for bringing this message out to our Hidalgo County residents, because it is important. All we're asking for is flexibility. Give us an opportunity to make our own decisions, because we know what's best. Thank you, guys.
Okay, now we will open it up for questions, but I ask that if your question is off topic, Please wait till the end. Every gentleman up here has agreed to have individual conversations with you if your questions are off topic. Go ahead. Yes, ma'am. In the back, Ivana.
Do we have any numbers or information on how many kids between 12 to 17 or 12 to 18 have been vaccinated so far in the county?
That number, we're working on the state and getting that number. That's through the M-Track system, and we're trying to get that number in place. But I would say a guesstimate, an estimate of how many children would be vaccinated. We're looking at about 15 to 20% of the 12 and older have been vaccinated. We're still a long ways from getting to a majority of those adolescents being vaccinated.
Sorry. You mentioned that you have put in requests to the commissioner to try and get more resources to help with testing for variants.
There was a letter put out by the county, Judge Cortez, and the judge from Willacy County, Cameron County, and Starr County, that we're requesting, and the hospitals all agreed on getting more accessibility for variant testing through our hospitals. Only the CDC in Atlanta and in Fort Collins and the Texas Department of State Health Services in Austin Laboratory are the only ones that could officially confirm a variant. So we're asking for more capability for more variant testing, and that's being reviewed by the Department of State Health Services.
You mentioned that the increase of ICU vaccinations from July 11th to the 18th, that's just last week, is a 90% increase in ICU admissions.
Admissions, okay. Mhm. That is correct.
What percentage of those are people
So
who are
let me just repeat a
unvaccinated?
couple of things. One, remember, Dr. Melendez and I were just explaining that 90% of the hospital admissions with COVID are people who are not vaccinated, okay? So they're not vaccinated. So the increase in ICU has to do with the fact that there is complications with these people that require ICU treatment. But the main factor, the factor you need to really highlight, is that those people who were admitted, 90% of those people admitted to the hospital, were not vaccinated. And they could have, if they would have been vaccinated, they probably would have never been in the hospital.
Everybody who is in the ICU for COVID-related reasons, these are all unvaccinated people. Nobody who has the vaccine is hospitalized for any reason.
Yeah, go ahead and cover that. It's a question, it's an odd question.
Yeah, so first and foremost, less than 1% of the positive tests are being segmented. Epidemiologists tell us that an ideal number of segmentation with variants would be 10%. So we're far, far away. So when we confirmed the Delta a couple of weeks ago, to a lot of fanfare from the media and the community, we up here were like, yeah, I mean, we know it's been here for a long time. So to address your question really is minimal, regardless of the percentage, and we need exponentially more testing, but we're limited by the resources allotted by the state. But believe me, we've been hounding the judge, man. Send the letters, pick up the phone, you do what you can. We really need that to see where we're at. And then very quickly, in reference to your question, there are people in the ICU that have been fully vaccinated. I can't tell you if it's 2 or if it's 4, but I can tell you it is the overwhelming minority of people that are admitted. And to add to that, those people that are in the ICU are there for one reason: they can't breathe. They've maxed out everything that we can do on the floors. They've maxed out everything we can do at home. But in order to use the apparatuses that we have, not just ventilators, the other apparatuses that we have, they need to be there because of the machinery that's needed. That's why they're there. But the spirit of your question of how many, yes, we've seen it, but a vast, vast minority.
Well, I'm not a doctor, but I do know a little bit about numbers and statistics. If 90% of the people that became hospitalized were unvaccinated, then that additional increase to the ICU came from 90% unvaccinated. So there will be a correlation between the total number of people that came in to the number of people that were sick enough to go to ICU. So if I would have to guess, it would be pretty close that the new admissions to the ICU, 90% were unvaccinated. Is that a reasonable assumption?
Yeah, I think you've hit it on the head, and just to add to that, one of the hospitals, which I don't want to mention the hospital, last week I was running the unit, they had 17 patients. Yesterday, they had 39. And so these are in the COVID units. So, I mean, we can get lost in the, in the trees, but not the forest. The real loud message for you guys is unvaccinated. This, man, if you can quote Dr. Melendez on one statement today, because you know I like to talk, man. And so one thing, this is a pandemic of the unvaccinated. If you were to count the numbers of people that are sick that are vaccinated, it would not be a pandemic. It would be like, oh yeah, you know, we have 11 people in the hospital, so what? We have 11 people with heart attacks. So let me walk away and say this is a pandemic of the unvaccinated.
Doctor Melendez, hablaba de la pandemia de los no vacunados. Prácticamente, explíquenos un poquito qué es a lo que se refiere con eso y cómo está impactando esto a las comunidades, bueno, más que nada a los niños pequeños, que es lo que ustedes están tratando de decirle al público.
Afortunadamente, la pregunta es si esto es una pandemia de los que no son vacunados, cómo esto impacta a las personas que no pueden ser vacunados, que vienen siendo la gente menos de 12 años, ¿verdad? Esa es la pregunta. Entonces, obviamente, y gracias a Dios, que este grupo de personas, ese subgrupo de personas, son los que sufren las consecuencias mínimas, sea diabetes, alta presión, colesterol, casi todas las enfermedades en los niños son mucho menos agresivos, y COVID es igual. Entonces, aunque ese segmento de la población no está vacunada, definitivamente son los que tienen más recursos para no enfermarse dramáticamente, morirse o tener secuela impactante. Lo importante entender que aunque por porcentaje es muy bajito, no es cero. Entonces, si fuera mi hijo, o si fuera en el caso mío mi nieto, ¿verdad? O sea, una muerte es una tragedia. 1 millón de muertes es una estadística, ¿verdad? Entonces, una muerte es una tragedia. Así que este grupo, aunque son menos, no están vacunados, sufren menos consecuencias. El punto es que no son inmunes a la muerte. Número 2, que sirven como ¿qué? Como el río que tienen los pescados, ¿verdad? Sirven como un grupo de personas que mantienen este virus vivo. Y ese es el problema. Afortunadamente, yo tengo mucho optimismo que ya para más o menos la época de Halloween va a haber una de las vacunas que ya va a estar aprobada para los 2 años para arriba. Eso no es seguro, pero los números que estamos viendo, los estudios que se están haciendo, inclusive aquí en el Valle, tienen resultados muy positivos. Así que ojalá que ya para unos 2, 3 meses eso sea otra herramienta en el equipo, ¿verdad? Gracias.
Anybody else? Okay, everybody here has agreed that they are willing to have one-on-one interviews if you need sound bites in Spanish. So with that, we'll conclude the press conference. Thank you all.